Thank you for being here. This short video covers stroke risk and simple steps you can take to support your brain health. Whether you're part of Nourish or just learning more, we're glad you're taking this step. Enjoy this short video, and at the end, see how to learn more and get involved with research and the Center for Healthcare Innovation.
Let's switch over a little bit, though, to racial and ethnic groups. Now, you're in a very busy center at Rush, stroke center. Acute strokes are coming in. You're a comprehensive center, which means you get cases, if you will, patients from all around the area. What have you seen from racial and ethnic differences in stroke and disparities based on your experience?
Yeah, great question. When you think of where Rush is located, we're really at a sort of convening point of a lot of different neighborhoods in Chicago. And so we get a very diverse patient mix and, see people from different communities. And we do see challenges in some of our minority patients, just with resources, access to care, and those trends bear out at the national level. So when you look at, for example, Black patients, for Black women versus white women, your risk of having a stroke sometime during your life as a Black woman is double that of a white woman. When you think about stroke outcomes, how likely you are to die from your stroke, Black men are 70% more likely to die than their white counterparts. And so you look at that, and there is a difference. There are disparities, and there's a variety of things that could be playing into this. It's an area of research that is growing. People have an interest in it. And so things like insurance, do you have coverage? Is it good coverage? After you have your stroke, are you going to be able to qualify for an acute rehab and maybe therapy services after you leave the rehab? There's an element of health literacy. And what I mean by that is we have a complex system. I have to say, I'm a physician, and when I have to get care as a patient, it's confusing. And
Very confusing.
I think I'm a reasonably smart person, but it can be really complicated to figure out the insurance benefits and the logistics and all of that. And if you have somebody who's doesn't work in the healthcare system and maybe just their educational level overall, they may be at a disadvantage in trying to navigate some of that because there's a lot of moving pieces and a lot of complexity. Exactly. The other thing is historically, just mistrust of the healthcare system. I think that the medical community needs to own that there's been instances in our history in America where minorities were not treated well. And that level of kind of, if I present in, am I going to get the best care and the right care? And so that may be a barrier for people reaching out as well. So those are a lot of the things, and we'll get into the food and nutrition and kind of community factors a little bit later. But certainly the area that you live in, the infrastructure that's there, both for healthcare, a clinic, do you have to drive? I have a lot of elderly patients, and sometimes if they're not driving anymore, they may have to take the train and a bus and, transfer to a shuttle. And it can be really onerous for them to just kind of make their way around the city. And that can be difficult as opposed to having something that's walkable to their home. So all these things play in together into creating an environment where, not just your risk factors that we talked about earlier, basic things like blood pressure and diabetes and hyperlipidemia, but then also acutely, if you're having an emergency, how you're going to be funneled into the healthcare system may vary depending on the geographic region that you live and the resources in that region.
Yeah. I think, again, you've unpacked a lot here, and these are all these considerations, and frankly, it all plays out when people come in. So all those things that were happening in the community are now coming into the hospital system.
Thank you for being part of this conversation. Through the NOURISH Study at Rush University Medical Center and our partnership with the Center for Healthcare Innovation, we're exploring how nutrition and food access impact brain health and stroke outcomes. Learn more about the Connecting the Dots series at chisight.org. If you missed a study visit, that's okay. we're here to help. If you have questions, want to reschedule, or simply want to learn more about our work, please reach out to our field team using the contact information on your screen. We'd love to hear from you.